Which congenital disorder is associated with a single palmar crease? Options are A. Down syndrome, B. Turner syndrome, C. Klinefelter syndrome, D. Edwards syndrome. The answer is A. Down syndrome. A single palmar crease, simian crease, is a characteristic feature of Down syndrome. Which scale is used to assess pain in neonates? Options are A. Flack scale, B. Wong-Becker-Facer scale, C. Apgar scale, D. Cry scale. The answer is D. Cry's scale. The Cry scale is designed to assess pain in neonates based on crying, oxygen requirements, vital signs, facial expression, and sleeplessness. The maximum score of 10 is possible. Which feature is most characteristic of Kawasaki disease? Options are A. Maculopapular rash, B. Conjunctival redness and strawberry tongue, C. Erythema nodosum, D. Petechiae. The answer is B. Conjunctival redness and strawberry tongue. Kawasaki disease presents with fever, conjunctivitis, and a strawberry tongue. Which reflex disappears last in infancy? Options are A. Moro reflex, B. Palmar grasp reflex, C. Plantar grasp reflex, D. Rooting reflex. Answer is plantar grasp reflex. The plantar grasp reflex disappears by 9 to 12 months while others disappear earlier. At what age does the posterior fontanelle close? Options are A. 6 months, B. 8 weeks, C. 12 months, D. 4 months. Answer is B. 8 weeks. The posterior fontanelle usually closes by 6 to 8 weeks after birth. The rule of 9 is used to. Options are A. Assess malnutrition, B. Evaluate dehydration, C. Calculate body surface area burned, D. Determine growth percentile. The answer is C. Calculate body surface area burned. The rule of 9 is a method to estimate the percentage of burns. The Apgar score assesses all the following except. Options are A. Reflex irritability, B. Respiratory effort, C. Skin color, D. Birth weight. The answer is D. Birth weight. Apgar scoring evaluates appearance, that is skin color, pulse, heart rate, and grimace, otherwise known as reflex irritability, activity, that is muscle tone, and respiration, but it does not include birth weight. What is the cause of a Sale sign on a neonatal chest X-ray? Options are A. Pneumothorax, B. Enlarged thymus, C. Athletaxis, D. Pleural effusion. The answer is B. Enlarged thymus. The Sale sign on X-ray is due to the normal enlarged thymus seen in neonates. Which electrolyte imbalance is seen in pyloric stenosis? Options are A. Hyperkalemia, B. Hypokalemia, C. Hypernatremia, D. Hypocalcemia. The answer is hypokalemia. Persistent vomiting in pyloric stenosis causes hypokalemia, metabolic alkalosis, and hypochloremia. A child presents with frothy, foul-smelling stools and failure to thrive. What condition is most likely? Options are A. Celiac disease, B. Lactose intolerance, C. Crohn's disease, D. Intussusception. The answer is A. Celiac disease. These symptoms are classic sign of celiac disease, which is an intolerance to gluten content. Which condition causes a ground glass appearance on neonatal chest X-ray? Options are A. Meconium aspiration syndrome, B. Neonatal pneumonia, C. Respiratory distress syndrome, D. Bronchiolitis. The answer is C. Respiratory distress syndrome. The ground glass appearance is due to surfactant deficiency in respiratory distress syndrome. What is the fluid of choice for initial resuscitation in pediatric shock? Options are A. 5% dextrose, B. Ringer latate, C. Normal saline, D. 10% dextrose. The answer is C. Normal saline. Isotonic fluids like normal saline are used for fluid resuscitation in pediatric shock. What is the characteristic feature of scarlet fever? Options are A. Strawberry tongue, B. Maculopapular rash, C. Vesicular rash, D. Petechiae. Answer is strawberry tongue. Scarlet fever caused by group A streptococcus presents with a strawberry tongue and sandpaper-like rash. What is the key feature of nephrotic syndrome in children? Options are A. Hematuria, B. Proteinuria, C. Hypertension, D. Oliguria. The answer is B. Proteinuria. Nephrotic syndrome is characterized by massive proteinuria, hypoalbuminemia, edema, and hyperlipidemia. Which condition is characterized by a bulging fontanelle in an infant? Options are A. Dehydration, B. Hydrocephalus, C. Malnutrition, D. Anemia. The answer is B. Hydrocephalus. Increased intracranial pressure due to conditions like hydrocephalus causes a bulging fontanelle. Which vaccination is contraindicated during pregnancy? Options are A. Influenza vaccine, B. Tetanus toxoid, C. Rubella vaccine, D. Hepatitis B vaccine. The answer is C. Rubella vaccine. Rubella vaccine is live attenuated vaccine and which is contraindicated during pregnancy because it may cross the placenta and present a risk for the developing fetus. At what age should a child receive the first dose of MMR vaccine? Options are A. 6 months, B. 9 months, C. 12 to 15 months, D. 18 months. The answer is 12 to 15 months. The first dose of MMR is administered between 12 to 15 months. At what age does the anterior fontanelle typically close? Options are A. 6 months, B. 8 to 10 months, C. 12 to 18 months, D. 2 to 3 years. The answer is C. 12 to 18 months. The anterior fontanelle closes between 12 to 18 months of age. What is the normal heart rate of a newborn? Options are A. 60 to 100 beats per minute, B. 120 to 160 beats per minute, C. 80 to 120 beats per minute, D. 90 to 140 beats per minute. The answer is B. 120 to 160 beats per minute. The normal heart rate of a newborn ranges from 120 to 160 beats per minute. Which of the following is the first sign of puberty in boys? Options are A. Growth spurt, B. Testicular enlargement, C. Pubic hair growth, D. Voice deepening. The answer is B. Testicular enlargement. Testicular enlargement is the first physical sign of puberty in boys. What is the preferred vaccine for rotavirus? Options are A. Live oral vaccine, B. Inactivated oral vaccine, C. Subcutaneous vaccine, D. Intramuscular vaccine. Answer is A. The live oral vaccine. Rotavirus vaccine is a live attenuated oral vaccine given to prevent severe diarrheal diseases. What is the most common cause of death in children with diarrhea? Options are A. Acidosis, B. Electrolyte imbalance, C. Hypovolemia, D. Sepsis. The answer is C. Hypovolemia. Dehydration and hypovolemic shock are the main causes of death in children with diarrhea. Which of the following is the primary goal in managing a child with croup? Options are A. Reduce fever, B. Relieve airway obstruction, C. Increase fluid intake, D. Administer antibiotics. The answer is relieve airway obstruction. Airway obstruction in croup characterized by a barking cough, which is managed with humidified air or nebulized epinephrine. What is the most common cause of acute renal failure in children? Options are A. Glomerulonephritis, B. Dehydration, C. Hemolytic uremic syndrome, D. Sepsis. The answer is C. Hemolytic uremic syndrome. HUS is the leading cause of acute renal failure in children, which is often caused by E. coli infections. Which vaccine is contraindicated in children with severe egg allergy? Options are A. MMR, B. Influenza, C. Rotavirus, D. Hepatitis A. The answer is B. Influenza. Some influenza vaccines are prepared using egg-based production, which may trigger allergic reactions. Which vaccine prevents meningitis caused by Haemophilus influenza? Options are A. BCG, B. Pentavalent vaccine, C. Rotavirus vaccine, D. PCV. The answer is B. Pentavalent vaccine. The pentavalent vaccine includes Hib, which prevents meningitis caused by Haemophilus influenza type B. A 2-year-old has bow legs. Which is the likely cause? Options are A. Vitamin C deficiency, B. Vitamin D deficiency, C. Protein deficiency, D. Iron deficiency. Answer is B. Vitamin D deficiency. Bow legs in children are commonly associated with rickets caused by vitamin D deficiency. What is the normal weight gain for an infant in the first 6 months of life? Options are A. 100 to 150 grams per week, B. 50 to 75 grams per week, C. 200 to 250 grams per week, D. 25 to 50 grams per week. Answer is A. 100 to 150 grams per week. Infants gain approximately 100 to 150 grams per week during the first 6 months, doubling their birth weight by 6 months. What is the key characteristic of febrile seizures? Options are A. Occurs with fever more than 38 degrees Celsius. B. Lasts more than 15 minutes. C. Associated with neurological deficits. D. Always occur in infants under 6 months. The answer is A. Occurs with fever more than 38 degrees Celsius. Febrile seizures are associated with fever more than 38 degrees Celsius and typically last less than 15 minutes. Which is a common symptom of rheumatic fever? Options are A. Cyanosis, B. Chorea, C. Hematuria, D. Jaundice. The answer is B. Chorea. Sydenham's chorea, a movement disorder, is a hallmark feature of rheumatic fever. Chorea is a neurological disorder which can cause involuntary, rapid, and irregular muscle movements. What is the first step in neonatal resuscitation? A. Start chest compressions. B. Administer oxygen. C. Position and clear the airway. D. Intubate the neonate. Answer is C. Position and clear the airway. The first step in neonatal resuscitation is ensuring the airway is open and clear of obstructions. Which condition is associated with olive-shaped mass in the abdomen? Options are A. Intussusception, B. Pyloric stenosis, C. Hitchspring disease, D. Wilms tumor. The answer is B. Pyloric stenosis. The hypertrophied pyloric muscle feels like an olive-shaped mass in the right upper abdomen. Which of the following is the primary feature of cystic fibrosis in children? Options are A. Proteinuria, B. Chronic cough, C. Seizures, D. Hypotonia. The answer is B. Chronic cough. Cystic fibrosis is a genetic disorder causing thick mucus buildup leading to chronic cough and respiratory issues. What is the normal capillary refill time in children? Options are A. Less than 2 seconds, B. Less than 4 seconds, C. Less than 6 seconds, D. Less than 1 second. The answer is A. Less than 2 seconds. A capillary refill time of less than 2 seconds is considered normal in children. Which condition causes a sunken anterior fontanelle in an infant? Options are A. Dehydration, B. Hydrocephalus, C. Increased intracranial pressure, D. Meningitis. The answer is A. Dehydration. Dehydration leads to reduced intracranial volume, causing a sunken anterior fontanelle. What is the common presenting feature of intussusception in a child? Options are A. Abdominal distension, B. Bilious vomiting, C. Current jelly stools, D. Peritonitis. The answer is C. Current jelly stools. Intussusception causes ischemia of the bowel, leading to bloody mucus stools, which is described as a current jelly stools. What is the most common cause of dehydration in children? Options are A. Diabetes, B. Gastroenteritis, C. Renal failure, D. Fever. Answer is B. Gastroenteritis. Acute diarrhea from gastroenteritis is the leading cause of dehydration in children. What is the most common complication of measles? A. Pneumonia, B. Otitis media, C. Encephalitis, D. Diarrhea. The answer is option A. Pneumonia. Pneumonia is the most common and serious complication of measles, especially in malnourished children. Which is the most common congenital infection? Options are A. Rubella, B. Cytomegalovirus, C. Toxoplasmosis, D. Syphilis. The answer is B. Cytomegalovirus. CMV is the most common congenital infection worldwide, causing sensory neural hearing loss. What is the calorie requirement for a newborn per kg per day? Options are A. 50 kilocalorie, B. 100 kilocalorie, C. 120 kilocalorie, D. 150 kilocalorie. The answer is C. 120 kilocalories. Newborns require approximately 120 kilocalorie per gram per day for adequate growth and development. Preterm newborns, whereas they need 100 to 150 kilocalorie per kg per day. If you find the video useful, please like, share with your nursing friends, and subscribe the channel Nursing Exam Insight, your ultimate resource for all nursing exams. Thank you.